Good evening, cat lovers. Today, we are here to discuss something which is very important, essential, and interesting. We might have discussed a lot about cat upkeep and health, maybe topics like UTI or maybe fungal infections or breeds and things like that. But there is one topic that we try and oversee, and we don't pay our attention. That is dental care. So, talking about dental care in cats, it's a very essential topic, and reports share that 90% of cats older than 4 years suffer dental diseases, which is disease related to teeth and gums. So today, talking about this important topic, we have Dr. Vinod Sharma from
Hi.
Delhi. Hello, sir. Good evening.
Very good evening. How are you, Saket?
I'm good, sir. I'm good, sir. How about you?
Very good. Keeping up.
And thank you, sir, for accepting our invitation. And it's being an important topic. And I think there is a lot of things. There is a huge scope for each and every cat lover to learn. Before we go ahead with the topic, I would just like to introduce you all to about Dr. Vinod Sharma. So, Dr. Vinod Sharma has experience in small animals and large animals and internal medicine, various surgical and clinical procedures, including radiology, laboratory diagnostics, and nutritional therapy to animals. He has certificate in clinical training from Zurich, Switzerland, back in July 2003. He has attended numerous programs which conducted various trials in veterinary medicine and pet food in collaboration with leading pet brands in across the globe. Presented paper in World Animal Welfare Congress, London, back in 2000. An article published in Indian Veterinary Medical Journal in September 1996. He has attended various international conferences related to animal welfare. There is some more interesting facts that I want to share about Dr. Sharma, about his awards and achievements. He is Dr. Ben Wider Award. He won Ben Wider Award 2006 by Young Men Association of India for Animal Welfare. Published book Care of Dogs and Cats, National Book Trust of India, and another book, Cattle, Sheep, and Goat Care and Management. He has featured in various TV and radio talk shows on pet care and clinical nutrition, an article leading newspaper like Hindustan Times, Times of India, and in various magazines like India Today, various pet magazines and foreign magazines. He has worked in disaster management team at various occasions with WSPA. And there is one more thing that I would like to tell all our cat lovers, that you have also been listed in Limca Book of World Record for, I think, blood transfusion of German Shepherd, and I think that was the first blood transfusion done ever in India.
They've been doing, the first private blood bank we established in Jivasham long back, 2013.
Oh, wonderful, wonderful. And so what are we going to discuss today? And
So yeah, yeah, please, you want to say something on this, or I should, how it go? Yeah.
we all are waiting to hear from you.
Okay, so we are, hi listeners, welcome to my presentation. Thank you so much for your passion, for a long day waiting and all that. So we talk about dental care. Dental teeth and dental care is very important in our personal life also, because we start everything from the mouth and for the animals also. So I would start sharing my presentation with you guys. So it will be a dental hygiene, dental care, and okay. So I come here and can you hear me, Sakit?
Yeah, can you just put it on full screen so that it will be easily visible for all the cat lovers?
Is it now?
Um, yeah, it's now in full screen.
So, listeners, in my language, cat means what? Cat means clever and talented animal. So I always say cat means clever and talented. So you have the best friend in home is which is very talented and clever. So that's in my language is the cat definition of a cat. When we come about our topic today about the dental care, is very important, and keeping healthy teeth and gums make for a healthy cat. How we keep, why it is important, healthy teeth, because the teeth is one part where it starts. The food starts from here. The digestion process starts from here. So what your vet will check your cat's teeth during her annual exam, right? Like or checkups when you just go to them. So he will guide you. He will examine his all gums and teeth and all the buccal cavity, and what you can do at home is like to prevent gum disease by brushing your cat's teeth regularly. So cat tooth brushing is something you can have a very soft brush at home, and you can just there are many toothpaste available for dog and cat friendly toothpaste which are available in the market. You can use them, and at least once in a day that can be done. And then how you looking after your cat's teeth? Tooth and gum problems occur in 8 out of 10 cats around the age of 3. So what Sakib has said in the beginning, like this we people ignore it, but there are so many problems they come, in the when they are after 3 years or 3.5 years, 4 years, when they just grow or they get older, there are many problems which they start from the teeth and we ignore it. So establish a routine of brushing, as I'm repeating again and again for your cats, teeth as early as possible when they are kitten. So when their teeth are good, your cat will keep smiling all the time, and she will eat good, she will digest it very well. And if you don't do it, then what happens? See, if cat tends to accumulate plaque, debris and bacteria on the outside of their teeth, when we see the teeth, as we have enamel and all that in the gums, there is a lot of space and irregularities of thing, and all the food material get accumulated, and it leads to bacterial formation, and then lot of plaques starts coming on this, and that leads to so many problems, maybe gingivitis, stomatitis, and dental health itself goes down. So your vet has to take care of it. He will just advise you how to go about it. He will do a teeth cleaning. He will remove the plaques, and he might advise you many other things. So what is gingivitis? Gingivitis, this hardens the form, which is a like form of tartar, irritating the gums and causing gingivitis, like the gums. When there is an infection of gums because of tartar, what we call plaques, it will irritate the gum and the base of the tooth and the gum where there is attachment, and it will lead to inflammation out there. Your cat might not eat properly, she will start salivating a lot, and there will be a lot of pain she will feel if you don't look after the teeth properly. And if you don't look after the teeth, how it's going to affect your health of the cat. It will affect many vital organs. The bacteria can even enter the bloodstream and damage the kidneys and other vital organs like your liver, your intestines, or maybe heart. So you have to be very careful and very responsible towards the dental health of the cat. Then I need to talk about signs of advanced gum disease. There are many diseases. If you see my slide, there is a when you just go very close to the your cat and she will start smelling. You can't stand that smell. So you have to open the mouth, see that maybe you will find some tartar, plaques, infection, and the slide shows that there is gingivitis and lot of tartar, reddened gums, bad breath, yellowish and brown tartar on the teeth, and lot of drooling, will happen. So vet will sedate your cat and will try to remove and manage everything, as far as possible with this process. But you can avoid it by looking after the dental health rightly. When gingivitis is very severe, you can see on the slide, cats may drop food from the mouth, and you will see, like you will just imagine there must be something wrong with my cat, but the problem lies in the mouth itself. So you have to look after. I'm just every moment and every third word is mine. Just please look after the dental health. If the cat is not able to eat properly because of the gums infection or dental problem, then she will lose weight. And when she will lose weight, she might develop other problems in the system. She can have kidney problems, she can have liver problems, and You know, your vet, who is a regular vet to your care for your cat, will might have to remove some teeth also, which is not good. If you don't look after it properly, you can save the tooth, you can save the dental health of the cat by regular checkups. So if there's a lot of problem, he might do a descaling, the ultrasonic vibration. There's machines and what we use for our human health, dental care. So when we talk about maintaining the oral hygiene is directly associated with the most adequate diet. So it comes then what should be fed. The cat with the use of products that are able to decrease the bacterial population responsible responsible by the accumulation of the plaque. I mean to say that the food has to be very good. The what type of a food you choose. It should be hard. The cat should be able to chew it properly. If she's not chewing the food properly and not able to use the tooth properly, then there will be bacterial population growth inside the buccal cavity, and there will be a lot of plaque will come. And due to the plaque and poor dental hygiene, cat can experience two type of teeth loss. The first loss, in routine, what happens when the cat is young, then we have a primary tooth and the permanent tooth. So I'm just trying to tell you that teeth loss. We sometimes feel that a cat is not having, kitten is not having the tooth. It's fallen off. So generally the cats have milk teeth, what we call primary teeth. Around 3 or 4 months of age, they lose them. And after that, the second set of tooth formed by 13 real teeth. They are in beginning they are 26, and later on they are 30 complete teeth. They are in the buccal cavity. Throughout the cat whole lifetime, it generally they lose one or two as the age grows. But if you don't look after it properly, then she might lose all of them. So please look after the good nutrition you should be given, and a proper brushing and cleaning of the teeth is very important. Any loss of tooth of a cat in adult life can represent a periodontal disease, most of the time due to negligence of the owner. So be responsible. I'm repeating myself again. Routine examination and routine brushing of the teeth is very, very, very important. As we just get up in the morning, early morning, we do, like brush our teeth, same way we have to brush the cat's teeth every day, or not every day. At least you can do thrice a week or something. At least do it. What are the common causes for dental loss? As I said, poor oral hygiene leading to tartar accumulation on the teeth and consequently gingivitis. Because if there is tartar on the teeth, there will be infection in the gums and it will lead to gingivitis. And many times what happens when they just go out, there is a fight among cats. So maybe due to trauma, they lose, the teeth. How the brushing is done. Teach your cat to accept a daily brushing or wiping of a teeth. You can use, uh, a cloth or maybe a tissue paper. First, wash your hands and pull back your cat's lip. Pull up. You can just lift them up, and then use soft brush or a rubber fingertip applicator plus special pet toothpaste, as I said in the beginning, in favor that your cat will find tasty, like mold or chicken-based toothpaste, and that can be put on the brush, and slowly that can be massaged and and brushed. So she will love it, and she will in the beginning mind she will not like it. Maybe later she will start loving it. And never use toothpaste made for humans because they are not meant for cats. Apply the bristles to the teeth at a 45-degree angle. How to use the brush angle reaching both the tooth surface and beneath the gum margin. So when you use the brush should not touch the gums. It should just only stick to the teeth itself, the complete dentine. It should not go up, otherwise you are going to hurt the cat. Use small circular motions, like very small and slow motions on the outer surface of the tooth. Start slowly and finish on a positive note. Be persistent but gentle. So you continue your brushing the teeth, but you have to be very, very gentle. She should not feel offended with us. If your cat is still very young, do not attempt to brush her teeth. You can still get her used to having her teeth touched from a very early age. So you can use your finger, while just playing with her, and the finger can easily start massaging the gums, and she will get used to this thing. So, what are the dental care? There are many dental things, care products available in the market. If your cat resists your handling their mouth, oral hygiene gels are available. So, you can use gels. These contain enzymes that inhibit the bacterial responsible for a plaque formation. So there are products in the market where they have certain enzymes which will stop bacteria to grow, which are responsible for plaque formation. So you can use those gels. You can give it to your cat directly or can be mixed with the food. So that's one way of doing it. And then I come to the dental chews are also available, as well as special dry food that contains fiber and exerted brushing. Uh, Action is to as your cat chews. And that's my clinic, it used to be maintaining good dental care, including part keeping and cat in optimum health. Thank you very much. Uh, yeah. Hello.
So thanks a lot. And I think it was a short and sweet and simple.
Try to finish it. Yeah. Yeah.
Yeah, yeah, and being a cat lover and a cat owner, there were few takeaway points that I would like to readdress to the crowd that it's very important to get your cat acquainted to the toothbrush or the toothpaste. So there are a lot of questions coming in where people are asking that their cats is already more than 1 year old and they have never tried toothpaste or toothbrush, or the smell is a hostile element for them. So how would they try and interact, and they would bring this element into, because they want to take care of your dental care. And it was fantastically explained by Dr. Sharma by saying that you have to do it step by step. You have to first make the smell comfortable with the cat. You don't have to go for a war with your cat for the toothbrushing, and then it has to be between above the gums and on the tooth surface. You have to do it on 45 degrees and in a circular motion. So I think that's something which is fantastic and something that we all would try at our home.
It has to be slow. It has to be very slow. You can't jump in one day and take the brush and start, like brushing it. No. Go
Exactly.
step by step, you said. Yeah.
Yeah. And I think those who are watching and those who already have kittens, so this idea of brushing the teeth can be indulged into the cat right from the very early age, because it happens with grooming, Dr. Sharma, that people will say that cats fear water, but we do have cats that they will just wait for the bathrooms to get open and they will jump into water. That's because we
Yeah.
started at a very early age. So water is no more a hostile element for them when it comes to grooming. So similarly, I think when you start early and make your cat comfortable about brushing, it will not be something which are they uncomfortable, which are they not comfortable with. And knowing about this fact that the teeth are very important for cats, I think the prevention is the most important thing that you would recommend.
Prevention is key to many things, and if your dental hygiene is good, Saki, what happens? They're able to chew the food, and a lot of digestive enzymes are secreted, and it helps in digestion. Proper digestion means your cat will remain healthy.
Right.
Immune system will be always good. So
Hmm.
what generally people they do, give this, give that, but you can't ignore that your teeth.
Exactly.
And what is happening in India, the things are slowly in the veterinary profession increasing. Now we are setting up a hospital in Gurgaon, while DCCA Animal
Hmm.
Hospital and other hospitals there are existing in India. So then now pets are so equipped, they can always help you with your dental tartar removal. They can guide you on the dental hygiene, but you have to ask them. Just
Okay.
request them just to please examine the oral cavity once. If you see any problems, there could be some dental caries, dental, a breakage of tooth. So it's always good.
Right, right. And sir, correct me if I'm wrong. Working and working with pet food manufacturers for a very long time and doing some technical discussions. This is one thing that I learned, that cats love that experience of bursting the kibbles in their mouth. Okay,
Oh yes,
so because in wild they would like that experience of breakage of bones and something, so that the kibbles are so formed that they will burst in the cat's teeth. and many a times what happens is these teeth will fall off, and then people have to keep the cats on wet food, okay, complete wet food. And
Yes.
somehow cats are not comfortable because with this, and they are not liking the experience, and we see a lot of behavioral changes and a lot of stress being induced into cats which are only on the wet food. So
Yes.
teeth being a very important aspect, and I think we should take care. Once it's gone, I think it's tough for you to bring back. So how would you comment on that?
See, if we come to the dry food and the wet food, and when we talk about the kibble, if you see the
Right.
kibbles have different patterns, different sizes, different shapes, and everything. It doesn't mean it is for the fashion or a show. No, it is for the meaningful purpose. When
Mm,
there's a different size, this is like a hexagonal or round or anything. When
right.
cats start chewing the food, the gulp, it goes and touch different parts of the system. So it
Mhm.
helps in removal of tartar and keeping the dental hygiene good.
Right.
So again, keeping the wet food regular in the system, it's not good. It's not advisable. So do use dry kibbles, which are very good for the
Yes.
dental hygiene and proper nutrition as well.
And
So
as
they
you
drink.
said, the inception of nutrition starts from mouth. So that's the reason your teeth and your gums are very important in
Yes,
whole process.
gums and teeth are very important. If you are having some inflammation, pain, you will not eat. Where you complain, the complaint is that the owner, the master, like the cat person has to really know his or her cat. So I should be so friendly and so good in handling from the when they are kittens that I should be open the mouth very gently and start playing. They should love your touch, so you can easily examine it.
Okay.
So these are the
So
things, when you start wearing it, then you come to know about step by step, step by step. So you don't jump on one day that I'm going to just brush it today. No, you have
yeah,
to just step by step do it.
yeah. And I think what you also mentioned, which is a key to all this thing, is the relationship and the bond between cat owner and the cat. So if you have that thing, I think your half the battle is won then and there.
Yes, yes. And when
So
they get older,
mhm,
uh, they start having many other problems along with maybe arthritis, maybe other kidney problems or liver problems. Then it is when you are friendly with them from the very beginning, you can easily help them in that age. They live
oh,
long. So friendship starts at when they are kitten. You start playing with your fingers, and then slowly, slowly, like what I advised you, the brush and stuff and all that gels. It helps. It helps in maintenance in the friendship relations. It maintains, keep your relations very good.
yes, yes,
And
yes.
generally, we ignore that touch and feel. So I always say in my practice, time, space, money. If you have a lot of time, you will spend with the animal. Do spend
Oh,
and buy some good stuff, the good product, not the stuff which is not good for your animals. Don't buy that. Always take your help of the vet. Just
yeah.
don't go in the pet shop directly and ye bhi de do, ye bhi de do. No, you just ask your veterinarian first, the expert first, or it could be anyone. Like the person who's a cat person can advise you. The vet is the right person, but there are many other people. Like you are an expert in cat yourself, and your experience with many years now can guide so many people and even the vets also.
So, but one thing which is missing, the element which is missing in our country, especially with cat lovers, is this timely periodic examination with vet. So that's something that it is like a disaster management only. Whenever there is a problem, you will run to a vet. But I think that preventive approach where you go and show your cat periodically, maybe say quarterly or once a month, and the vet will examine everything, and maybe you can demand that, sir or ma'am, can you please look into the mouth also, and then I'm sure they will be helpful and they will say yes to it, and that can solve a lot of problem because a vet has a different eye, and they are much more experienced because maybe this is my first cat, and it's been there with me for 5 years, but in that particular time, in 5 years, a vet might have seen more than thousand cats. So, they are much more experienced. So what would you recommend to our cat lovers, that how they should look into this thing,
I tell
preventive
you,
approach?
yeah, I'll tell you one thing. What happened generally, our country is more of a dog oriented pet owners. Pets are more of a
Mm-hmm.
dog and very less population of cats. So presentation of cats in the clinics is a very less number. It's not that high number as we see dogs, right? So you have to really many times insist the vet, like please do this follow up. Do ask, but generally now the vets, most of the vets, as I said you in the beginning, have all the equipments and they are trying to improve their infrastructure. They are trying to put many machines which are helpful, like ultrasonic scalers and all that. So they will definitely guide you now. They are far advanced to guide you that you please do this, do that, follow this up, feed this, use this diet or that diet. So they will guide you accordingly.
Right, right, right.
But
Thank you.
yeah, say it.
Uh, so we have many questions coming up. I think we'll take a few questions one by one, and then we
Yes,
can
yes,
also continue with the discussion.
please.
So Isha Gulati, she asks that there is no redness or anything, but sometimes there is bad smell from my cat's mouth.
See, generally what happens, Visha, in this case, like if there is no redness, it doesn't mean that there is no infection. Sometimes it is just, breeding up out there. So that can be one of the reasons. Second could be, your cat needs to be dewormed, or
Mhm.
she's not able to clear that. There is always something remained in the dental, gaps and all that. As I said, there is always something developing and breeding out there. So bacteria might be doing it. So get examined. Very important.
Okay, okay. So I
So
think this is
redness
an
will
alarm.
redness is not today. It is not there, but might be after 10 days or 15 days. It will come.
So I think, sir, this is an alarm, and Isha should be watchful and take necessary actions right
Yes.
away. And one of it would be to go see a vet and discuss this.
Yeah.
Yeah, yeah. So there's one more question by Akil, which says that, which products do you suggest for a proper dental health? I think you mentioned a lot of things in your presentation, which included gels and everything. But if you can please revise, because these products are not available, sir. To be very frank.
This is not the right platform to promote anything on the food, but I said, there are many gels available in the market. You have to just ask your vet out there what he has, or he can just
Okay.
procure for you. And secondly,
Mhm.
the cat food itself will help you.
Okay. Okay.
Yeah.
Thank you. Now, there is a basic question, but I think a lot of layman cat lovers will have this question that, why does the cat has tartar at first place?
I think so. The first step, very first or second slide, I mentioned about why they had the tartar. It is because there is no good hygiene. They are not able to shave it. There is a lot of accumulation. Food remains. Bacteria comes up, and it stays there. There is no proper cleaning, so the tartar will
Mhm.
come up. Yeah.
Right, right, right. And
It
I told you,
happens in
sir, that
humans. It happens in humans. If you are not good at hygiene, the dentition, dentist will ask for the scaling. That I want to do scaling because there's a lot of tartar out there. If you are not good at that. Or maybe,
right.
the other reason could be, the jaws are not properly, they're not bound with the proper jaws, and there is a not a proper system, and they are not able to use both the jaws properly, and it can lead to that problem as well.
Sir, I was coming to that, but good you took up this topic, because what happens is, because of, say, improper breeding, or it's an outcome of inbreeding, line breeding that happens in cats. And I think that's one of the reasons and key agenda of FCI, that we do ancestral tracking. And once we do the ancestral tracking, you can do selective breeding, and what you're breeding with your cat. Because sometimes you may just breed your siblings, or in the same blood group, or same bloodline, and you don't know, unknowingly you can do it, because there is no registration of paperwork. So
Yeah.
that's why FCI has been successful in providing the ancestral tracking, and people can do. But still, the problem exists that, in breeds like Persians mostly, where they are more prone, and their jaw is inside. They have small
Yeah.
nose. So there, the problem of dislocation of jaws, which is outcome of, say, line breeding, maybe. So that there are various other problems like head bumps, or
Yes.
there is kink in tail and things like that. But
Many, many
the
well.
yeah, yeah. So how do we take care of this issue? Because what we recommend about when you have jaw problem like this is that you should discontinue breeding of this particular line and
I
neuter
agree
the
with.
parent. Yeah, you need not produce kittens with defects. But now once they are produced, so how the owners can take care of this thing?
See, this is the when by fluke you had something like this, and then you know how to care about it. It is the vet who will perform certain X-rays on your cat. He will just
Yeah.
come to a conclusion what is the problem, where is the problem, the jaw or something. He can easily correct it there. So he's a vet who will advise you on this properly after doing the certain test and X-rays of the cat.
Okay.
And
Okay.
you rightly said it is
So
better not to breed it
manageable.
yours. Breeding have to
Uh,
be advised. Neutering is one choice in these cases. You get them neutered. There's the right way to do it.
right. Right. But it's manageable yet, because
It is
sometimes
manageable.
it's so disturbed that they have problem in chewing because it's complete mismatch, and we have seen cases where the food will fall off and they are not able to chew
Yes.
properly.
So then the vet will correct the alignment, and he can just make your cat comfortable to eat and chew everything properly.
Oh, thank you,
Yeah,
thank
but
you.
yeah,
I think we have already discussed about this thing that I have
I,
never trained my cat in brushing, and Neha asked this question that now they are already 1 year plus, and how to get used to dental care, and I think you have beautifully explained about the
uh,
bonding.
I think so. She can start with Neha can start with gels in this stage, and start playing with her lips and the gums with the fingers and the gel, or maybe with the turtle food, and then slowly she can start using the brush.
Okay,
That will be
okay,
better. And
understood.
these are like you have to be practical while you are doing. You have to know your cat properly. How she's going to behave, and then you can easily adopt any technique. Which I told you, the
Mhm.
45-degree angle or the gel or the finger and the food. Yeah.
Thank you, sir. We take one more question by Abhishek. He says that can you suggest any supplement for better tooth and gum conditions?
See, supplement you require when? This is the question I always ask my clients. When there is no good nutrition.
Okay,
If there is a good nutrition, balanced nutrition, then you don't require any supplement from outside. If the dental hygiene and the digestive system is good, then you don't require supplement because they will be absorbed properly. So give
okay.
a good food. Don't jump on supplements like that. Give good food, balanced few food to the cat. She will not require any supplement.
So basically, supplements is a systemic failure in your nutrition program. So
Yeah,
if your nutrition program is good, I think you don't require supplements.
exactly. That I always say to my clients. If you are good at nutrition, your digestive system is good, you are properly taken care of, well exercised, well stool form coming out, nothing. There is no required of supplements because it is properly absorbed.
Okay. But
Timely
sir, if there is,
deworming.
I'm sorry. Please continue.
Yeah, I'm saying timely deworming, timely vaccination, timely everything, and the good nutrition will keep your animal fit and fine, and you don't need supplement from outside. And when it is required, your vet is the right person. What is needed, whether he
Okay.
needs multivitamins or minerals or proteins or anything, he will just guide you on that time after doing again a proper check on the system.
Okay.
Feeding
Okay.
unnecessary things, maybe you can just give extra, or you can like it.
Yeah, because I think the idea of asking this question could be, what I can decipher is maybe there is an ongoing problem and
Mhm.
they are treating with it, and just to have the catalytic action of supplements that the treatment should be in faster way. So that's the reason Abhishek might be asking this question that which supplements that they can give when there is an ongoing treatment for say GGYTs or other problems.
But Sakib, what happens? If I start suggesting one or two names on this will be unethical for me to do it because
Yeah.
this is not the platform where I should recommend you just buy that product or so product or that product. No, I don't want to do that because right person is the vet who is treating the cat. He should advise. what is needed. Yes, as I said, you supplements are only needed and when needed when there is a problem. So
Okay.
I will not advise anything on. Sorry, Abhishek, that I will not give you any recommendation on supplements because it's not ethical for me to do it on this ground.
Okay.
Like if you are in front of me, I can prescribe you and give it from my counter itself. Please take this after examining the cat. I'm
So I
sorry
think
on this.
Abhishek, the right thing would be to consult your vet, and then he can examine the situation and then can recommend if needed for your
I
cat.
can name I can name hundreds of it, but I don't want to name. Yeah.
We can understand, sir. Thank you. Um, there's one more question which says that please guide about daily maintenance of dental health. So if you want to just summarize that, what a cat owner should do on a daily basis.
See, on the daily basis, when you start your day, like when you start giving them before giving the food, you just, be there in your lap. You start playing them. You start brushing them. While brushing and playing with them, you can always just check on the tooth, open the mouth, see if there is any problem, there is anything which is there is any bleeding out there, or there is any inflammation. As one gentle lady, she in the beginning there is a redness she has not observed, but there was some problem, she said. So if you
Yeah.
can easily notice, like a redness on the gums, or maybe any dental problem coming up, yellowness of the tooth is coming up, or there is a breakage, there is a something like that. You can easily observe it. This is one. While playing, and you can just start brushing it slowly, slowly. First, you start with your fingers, and then you can use brush. That's the help you can do, in routine. But it should be examined daily.
Yeah. Examination is must. Yeah.
So it's not like one day you do it and you forget for a month. No, you just do it. Make it a habit of like touching and playing it with her like this, and then slowly brushing it. It should be a routine.
So I saw a beautiful product once when I was maybe I think in Malaysia or Singapore that they had some socks kind of thing which can go into the
Effective
forefinger.
brushing. Yeah.
Yeah, and then you can just put it inside the cat's teeth, and it's amazing for starting, as a starter to because they
We
might get afraid of the toothbrush,
yeah,
so they
we
can use this
get
thing.
that in market out here with the toothpaste.
Yeah.
That the company who is making the toothpaste for the cats and dogs, they provide you that soft brush, and a fingertip brushed along with it. So when you go to the pet shop or to the vet shop, please ask it. They will, when you buy the toothpaste, they will definitely give it to you. And that's
Okay.
the way that you can start doing it. But keep one thing in mind, your hygiene as well. After brushing and touching all this, you have to wash your hands as you are washing today when you come out of or touch anything. Washing and keeping your health is equally important.
Thank you.
There's
I think that's a key
bacteria
point.
can, yeah. So when there is injury to your finger or any hand, you just don't play with that. So
Mhm.
it's always good, that your hand should be washed properly before and after.
Okay. And there's one more question from Mohammed Ayan. He says that is mouth issues directly connected to stomach conditions?
Many of them, yes. If they're not able to chew it properly, yes, they will have some digestive problems. And when digestive problem comes, it can lead to many other problems. And it can even lead to the kidney problems also, along with that heart problem also, if the dental hygiene and then there is a lot of gingivitis because this bacteria can travel to the heart and kidneys and other places.
Okay. Okay. Thank you. There is question from Leena. I think Jeans is name of a cat. So either the my Jeans eats only kibbles. Do I still have to get him to brush? So
There's no excuse to it. Please do it. Please
so
do it.
irrespectively, you're feeding raw food, kibble food, homemade food, or wet food, you have to brush your cat.
Um, please, Lena, do this. This is important. Yeah.
Okay. So um, okay.
And
So
Saki, what I have seen, how to maintain happy. Uh, sorry, yeah. Hmm.
you were saying
I
something.
always say, yeah, please, you're saying something. Yeah.
No, I was listening to you. You were saying that.
Okay. So, when we talk about dental things, now we have so qualified, veterinarians and good setups with the vets that they are so good at dental, maintenance stuff. They can just easily fill the cavities. They can tartar. There is a tartar removal machines and the proper settings. They do it. But your cat needs to be sedated for that, and everything is so well in market now. All the vets are very well equipped. It is only that I have to ask for it, and many times what even vets are suggesting it. Every periodically they should go and get all these things examined.
Okay, okay, okay.
So these are the
So
things, and
there are
yeah,
resources available. You mean to say that there are resources available? You just have to go and find for it and consult
yes.
your vet, and they are resourceful now.
I always say, anyone who's professional, please do consult him. But just don't buy things at your own, like what you see on the net, or you just somebody saying in a pet shop, or you're listening. Do consult a professional who will guide you a proper diet, how to do and use the brushes, which gel is good for your at the age of 3 months or 4 months, what is good when they are 9 years old or 18 years old or 19 years old. So all these things are important. So seek a professional advice always.
Yeah. So
Even
with
is
your
asking,
last
yeah, how
last
to maintain.
statement, we have this question from YouTube that Nelson asks that maintain healthy dental condition from kitten age itself.
So that's why I said, they can start using the gels,
Yeah.
and we have a kitten formula for while we start, raising them up. So they get in habit of eating that kibbles, and application of gels and a soft brush will keep the dental health in a very good condition.
Yeah. And I think Dr. Leena has
Thank you.
taken your Leena
Thank you
has
very much.
taken
Yeah.
your
Thank you very
suggestion
much.
very seriously, and she says that she will brush from now on.
Yeah, I appreciate it. Thank you.
Yeah, that's the whole agenda, of doing this sort of webinars. That that those that sort of best cat keeping practices should be followed by cat owners, and
Yeah,
experts like you can show us the right path.
yeah. Thank you. Thank you.
There's one more question. It's an interesting question that Sarika asked. That hi sir, my cat is 10 years old and has serious redness in her gums, and my vet mentions the tartar too. But is there anything we can work out orally to reduce the infection, as sedating her for scaling scares me cause of her age? Please advise.
When Sarika, in my opinion, don't get like scared about getting a sedated. As I said, mentioned before also, all the anesthesia is very good now. There will be no problems. I'm sure on that. The vet will be very intelligent when he's advising on the tartar removal itself. It means he has the facilities which I can make out with your lines out here. So don't worry about it, and don't try anything just because the vet is advising to removal of tartar and there is redness. Please get the tartar removed. It's not going to solve the problem by just advising you one stick, use this or use that. In this condition, no toothpaste is going to help. But after removal, toothpaste and other medicines will really help, and supplement will help her to keep oral hygiene proper. But go ahead for it. There will be no issues. I'm sure he will conduct a pre-anesthetic blood test. He will run through, and he will just have an assess what the condition is, and he will proceed for it.
Yeah, I'm sure Sarika would be motivated with whatever your suggestion is, and she would go ahead with the suggestion, sedating the cat. And
Yeah.
there is a question from Sindhu that she asked that which dental spray or liquid do you recommend for regular maintenance? And sir has already mentioned that instead of talking about brands, you must consult your vet and figure it out that which brush or which liquid or spray would be appropriate for your condition for your cats. And
Yeah.
if it is only for maintenance, sir, what would you recommend? Any toothpaste for cats will do, for pets will do.
Anything which is any toothpaste which is for available for cats in the vet shop, the pet shops, and
Okay.
a good quality one. And this is fine to regular maintenance. Yeah.
Okay, okay. So this is for maintenance. So for maintaining on daily basis, what you recommended, like every day you should
And
at least
Sindhuji, if you give them good nutrition, good kibbles, different type of kibbles, and different, the food, dry food is going to help a lot just to maintain the, dental hygiene in itself. Chewing is very important. Tearing is very important. Yeah.
Okay, okay, okay.
That's why we
And
have different types of the cats, the dent incisors, canines, and premolars and molars. Every tooth has its individual role to do it.
okay. And there are two questions which are related to the misalignment of cats. I think I'll read out both of them and then you can discuss about them one by one. So, one is by Gerry Sandhu. Do cats, especially the Persians, need braces to correct their tooth alignments? So, this is question number one. And Sindhu asked another question, which is related to the cross bites. So that there are a lot of cross bites issue in our cats. Do you recommend neutering such cats?
I
Over
would
to
say in Sindhu's case, I would recommend neutering. And neutering otherwise also is very good for your, if you are not in breeding line, if you don't want to breed, neutering always helps. So please, if you are not going to breed your cats, always get them neutered. This is always helpful for animal welfare also, and for the welfare of, the society as well, and for the animal as well. And coming to the first question, braces, like I've not done in my practice till now, and but the techniques are coming that, that broad, that they are trying to improve the dental systems, and they might, you will find the answer there. I have not done any dental corrections in my practice as of now.
okay,
We are just only stick to a couple of things like dental tartring, cavities, and stuff like that. But that level still we have to achieve.
okay. Thank
But
you, sir.
there are facilities abroad that where this practice is followed.
Okay. Azra Khan asks that my cat has excess saliva coming from her mouth. What could be the probable reason to this?
One of the reason could be dental tartar or gingivitis or stomatitis, infection in the mouth, oral cavity, and could be other reasons also. Might be having some, stomach upset or other problems. So get a proper blood test done and a proper
Okay,
examination done by the vet. So go for a proper thermal check and X-rays and all that. So let the vet examine, and could be one of the cause could be your dental tartars and gingivitis or stomatitis or any tooth problem or something like that.
so examination is must. That's something you are recommending. That in this
Examination
case,
is must. Examination. They can oral examination. Azra can do herself. Open the mouth and check it out if there is any redness, any pain, anything she observes.
smell.
You know, yeah, and then they can approach to the vet.
Okay, okay. So I think the primary examination can be done by her itself, and then
Yeah,
for
just
some expert advice, she can go to vet and consult.
you are right. Yeah.
Thank you, sir. Um, Saab asked that is teeth scaling recommended in cats?
Yes, I do.
Okay, there is no
Descaling
issue,
is
and it's completely safe.
one has to be good at that. One has to be very good at it. You can't just go and just start, like touching the dentine and then keep on doing it. It is a very intelligent work. So vet knows it.
Okay, and you have also mentioned that that kind of skill level and that kind of resources today. Fortunately, our vets in our country have it.
Yeah. We are improving day by day. Every day is a change.
Yeah, thank you. And I think we'll take a few more questions because there's so many questions coming up, and it's
Yeah, please
everybody
ask
have
any. Yeah, you
some
can
or the
ask
other
as
doubts on that.
any help. I'm really grateful.
Okay.
If I'm of any, if my advice can help animals, I'm so happy.
Yeah. So, Sam Wankhede, there's this question from Sam Wankhede. So, it's like, what is stomatitis, and can
Basically,
you tell us?
I tell you one thing. There is a gingivitis is basically the infection of the gum stem is a complete oral cavity infection is what we call the stomatitis,
Okay,
right? And then that, as first question, symptoms means like there will be a lot of drooling, there will be a lot of bad smell, and like all the time cat is making movements of the jaws up and down and irritated. All these are the small, very primary symptoms of stomatitis. A lot of smell, drooling, saliva drooling, and all that, and bad smell coming, and
okay,
problems in digestion also.
okay. Thank you, sir. So, Sarojini, there is a question from Sarojinee Kamble, and she asked that can giving plaque of powder every day will prevent tartar in our cats?
I have not used any plaque of powder in my practice, but I heard of it. You can.
Okay,
Yeah. I'm not using my practice, so I can't advise you on this. But yes, I've read it that yeah, there are a couple of things, and there is one. I think there is one Indian company which is doing it, and they advise you that if you mix in the food and that helps in preventing it. So why not?
okay,
Yeah.
okay. I think it's one more point to be learned, and thank you, sir. So, um, we have taken most of the questions, if I'm not wrong, and there are similar other questions which are coming to related to similar topic which we have already answered. So I would
Yeah.
like to skip those, and so that's it, sir. We have done with all the questions that we had, and any standing advice or any key points that you would like to tell, because we are at the end of this session, for the cat owners that they should religiously follow in their day-to-day activity.
I think the most important message I will try to give them a good nutrition, keep them healthy, happy, and fit, and be friendly to them. Get regular examination, then regular visit to the vet is very important. And secondly, stay safe and play safe.
Thank you, Dr. Vinod Sharma. It's always a pleasure to listen to you, and whenever you have spoken, I think on three,
And I
four,
just
four.
want to thank you so much. I just want to add two lines. As I said, I just work as a head of the hospital division, DCC Animal Hospital, which is
Okay,
my first project is going to be completed in January 21 in Gurgaon, and
hmm,
that will be with all the full facilities and with international experts. I'm not advertising it, but I'm just trying to, like pass an information where people can always come to us and take an advice, and the best facilities we are going to provide to the all animal lovers.
yeah. And I think that would be a lot of knowledge interface from abroad, because now those best practices can be implemented in our country, and it's a good news for all the cat lovers, I think. And steps like this, and you guys are pioneer into this, sir. I would thank from whole cat lovers and cat owners fraternity that you guys are taking step in that particular direction, where we have confidence in medical science and medical experts, so that we can often come down, and there is a bond between cat owner and the doctor, because that's the most important. You have mentioned about the bond between cats and the cat owners, but there has to be a bond between the vet and the cat owner, and that's how we can do better for the cat. That's what I feel personally.
And you are right, absolutely. And like keeping and praying for everyone best health, and all animals they should live long, and everyone. Thank you very much for putting me on here. Thank you.
No, thank you, sir. Thank you from all the cat lovers who are watching this session, and I'm sure all of those are going to share this information and this video, because this video will be there on our Facebook page as well as the YouTube page, and people can reassess whoever were not able to join now. So all our cat lovers will do share in different forums, and it will help in spreading awareness and knowledge in coming days and months. So thanks a lot, Dr. Sharma, again, and thank you, cat lovers, for joining. And happy petting. Thank you,
Yeah.
sir.
Thank